Ladies and gentlemen, before we proceed with the seminar, let us begin with a prayer. Let bow our head and offer a prayer according to our respected belief. Let's pray according to your believing. Thank you. And please remain standing. Ladies and gentlemen, to honor our beloved nation, Indonesia, let us stand together to sing our national anthem, Indonesia Raya. Please be seated. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, salam sejahtera, sawasdika, magandang umagapo. Good morning, distinguished rector, honorable speaker today, Professor Dr. Muhammad Hadi, SKM MK, Associate Professor Kamara Turner, PhD, stays joined in a Zoom now, Professor Virtut Portia, PhD, Assistant Professor Nurse Niluh Gedeni Tasri Wayuningsih, SKAP MMMK, our special guest from Taiwan, Chow Sang Hao, Miss Chetty Xu, she is caregiver supervisor in Taiwan Home Nursing, and Mr. Leo Lee, he is an aesthetic clinic doctor and nuclear medicine physician at Taipei Vietnam General Hospital. May you can stand up to and say hello to our participant. Okay, thank you. You can sit. And all faculty member and all participants seminar today. First of all, let us express our deepest gratitude to God Almighty for His blessing, which enable us to gather today in a good health for this international seminar. On behalf of the organizing committee, it's my great honor and pleasure welcome you to the international seminar on nursing leadership, which is also held in celebration 31st of Dies Natalis of ITKes Bali, with the theme, the Transformative Nursing Leadership for Safety Excellence, Ensuring Patient, Student, and Environmental Safety. My name is Ida Ayu Putri, and I will be your master ceremony for today's seminar. Ladies and gentlemen, the next agenda is welcoming remarks and the official opening of the seminar, which will be delivered by the Honorable Rector of ITKes Bali. It's a great honor for us to invite Associate Professor IGD Putu Dharma Suyase, SKP MNG PSD, Rector of ITKes Bali, to deliver opening speech and officially open this seminar today. To the Honorable Rector, the stage is yours.
Cek. Bapak Ibu yang saya hormati, adik-adik yang saya banggakan, Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, salam kebajikan, namo buddhaya, salam sehat untuk kita sekalian. Dr. Kamolrat, Sawadikap, Professor, yes, thank you. How are you, Dr. Kamolrat?
Very fine, thank you.
We have Professor Hadi here in our convention hall and Professor Portia here.
Oh, hello. Sawadika.
So, Dr. Kamolrat, Professor Muhammad Hadi, Professor Portia Fitted, and Ibu Nita, four of our distinguished speakers today, on behalf of ITKes Bali, let me say thank you very much. Gratitude from ITKes Bali that the four of you able to spend your time to share your knowledge and idea about patient safety. Professor Forsia, Dr. Kamalrat, this seminar today is also in line and in collaboration with the committee of ITEKES Bali 31st anniversary. Jadi Dies Natalis ITEKES Bali ke-31. Profesor Muhammad Hadi, Dr. Portia, and our distinguished participant from Taiwan, Dr. Kamalrat, I will speak into Indonesia for 1 or 2 minutes. Profesor Hadi adalah salah satu tokoh keperawatan di Indonesia yang ikut melahirkan program studi keperawatan ITEKES Bali, mulai dari sarjana keperawatan, profesi nurse, dan magister keperawatan ITEKES Bali. Adik-adik beri tepuk tangan yang meriah untuk Profesor Muhammad Hadi. Beliau adalah salah satu tokoh senior saya. Ya, secara pribadi saya sangat banyak berguru dari beliau. Beliau 8 tahun menggawangi AIPNI dan saya juga 8 tahun menjadi staf beliau, bukan staf ya, apa Pak Hadi? Menjadi pengurus AIPNI bersama beliau. Saat ini Prof. Hadi adalah penasehat AIPNI, sudah periode kedua, dan saya adalah wakil ketua AIPNI 1. Jadi saya juga banyak sekali mendapat masukan dan nasihat, termasuk kemarin sore sampai malam hari kita berdiskusi terkait dengan masa depan keperawatan di Indonesia. So once again, Prof. Hadi, thank you very much for your time, dan mohon doa dan dukungannya bahwa 4 tahun lagi Prodi Nurse akan melakukan reakreditasi untuk mempertahankan unggul yang kalau boleh 5 tahun, itu harapan kita. Untuk Magister Keperawatan kita akan lagi 3 tahun, mau meningkat dari baik sekali menuju unggul, dan sekali lagi kalau bisa 5 tahun. Prof. Hadi ini sangat knowledgeable, sangat experience dalam meningkatkan quality daripada nursing education. Jadi sekali lagi Prof. Hadi, mohon ke depan arahan dan bimbingannya selalu untuk kami adik-adik Prof. Hadi dan anak-anak Prof. Hadi. So once again, thank you very much Prof. Hadi. Professor Portia, so once again, thank you very much. You've been staying in our university for quite a while. This is your second official coming to Bali as a visiting professor, and you are leaving to Manila again in this coming Friday, but we will still collaborate, and we will together make a collaboration. For our distinguished participant from Taiwan, once again welcome to our university. I do hope that you enjoy your seminar today and enjoy your stay during your stay in Bali. Dr. Kamalrat, who is the Dean of Faculty of Nursing of PBRI, so once again thank you very much. I do hope that sometime this year we would be able to see each other face to face. And once again, thank you very much, Dr. Kamalrat. Say my best regard to our colleagues, students, and everybody, all our family in Thailand, in Bangkok especially. Bapak, Ibu, adik-adik yang saya banggakan, karena sesuai dengan permintaan MC tadi, maka dengan mengucapkan Om Awigana Mastu Namo Sidam, maka seminar internasional yang diselenggarakan oleh Prodi Keperawatan baik sarjana maupun magister yang dirangkaikan dengan Dies Natalis. So on behalf of ITEKES Bali, I would formally open the webinar today. Once again, congratulations, thank you, and enjoy the seminar. Thank you very much. Om Santi 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 Om. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much. Ladies and gentlemen, we will begin with the photo session. May I invite all of you to stand up and kindly step slightly forward because we will prepare for the photograph. Okay, can you stand up, all of you? Can you stand up and kindly step slightly forward, agak ke depan mungkin boleh Bapak Ibu. Please remain standing while we prepare the photograph. Kindly face the camera. Mungkin adik-adik boleh ada yang dari di tengah sini di atas naik boleh. Okay, can you face the camera? 1, 2, 3, smile. Okay, once again maybe. 1, 2, 3, smile. Okay, thank you. Please be seated. Okay, ladies and gentlemen, we will now approach the main seminar session, which will be guided by our respect moderator. Before the seminar begin, allow me to introduce our moderator by briefly reading her curriculum vitae. Our moderator is Assistant Professor Narsni Putu Kamariati Eskop MNS PhD, is a distinguished nursing academic and researcher with a strong expertise in a chronic disease, oncology nursing and nursing education. She earned her doctoral degree from Mahidol University, Thailand. Alongside her role as a lecturer, she actively contributes to research and scholarly publication, including authoring academic books. She currently holds the position of Dean of the Faculty of Health at ITKes Bali. Ladies and gentlemen, please give a warm round of applause to our moderator, Assistant Professor Narsni Putu Kamariati Eskop MNS PhD. Now, the seminar session is now officially handed over to the moderator. Thank you.
Yes, okay. Thank you. Thank you so much, Ibu Dayu Putri. Okay, distinguished guests, respected speakers, colleagues, and all participants at Convention Hall and the Zoom meeting. Good morning, selamat pagi, Om Swastiastu, Sawadika, Mabuhay. It is my great honor to welcome you to the international seminar entitled Transformative Nursing Leadership for Safety Excellence, Ensuring Patient, Student, and Environmental Safety. Today's seminar brings together nursing leaders, educators, researchers, and practitioners to explore how transformative leadership in nursing can create a strong culture of safety, not only for patients, but also for students, healthcare professionals, and the environmental. This topic is especially relevant in today's changing healthcare system, where leadership, innovation, and professionalism are critical to achieving safety excellence. Thank you to all participants who have joined us today, both on-site and online. We truly appreciate your time and commitment to advancing nursing leadership and safety. This seminar will be conducted in a panel discussion format. Each panelist will share their perspective and experiences, followed by an interactive discussion and a question and answer session with the audience. It is now my pleasure to introduce our distinguished panelists. The first one is Professor Dr. Muhammad Hadi, SKM MKep, from Universitas Muhammadiyah Jakarta atau UMJ. The second one is Dr. Kamola Tuner from Prarabonojanok Institute, Thailand. The third speaker is Professor Vituk Fortia from St. Paul University, Philippines. And the last one is nurse Niluhnita Sri Wahyuni, SKep MKep from Institute of Technology and Health, Bali. The first one, I would like to invite the first speaker. Let me introduce his curriculum vitae first. It is my great honor to introduce our distinguished speaker, Professor Dr. Muhammad Hadi, SKM MKep. He completed his doctoral degree at the University of Indonesia. He has extensive professional experiences. Currently, he serves as the Vice Rector for Academic Affairs and Cooperation at Universitas Muhammadiyah Jakarta. In addition, he holds important national roles as a member of the Indonesia Nursing Collegium and as the chair of the Nursing Accreditation Committee of LAM-PTKes. Professor Hadi is highly active as a keynote speaker, trainer, and facilitator in numerous seminars, conferences, and workshops at both national and international levels. He has also contributed significantly to the advancement of nursing science through scientific publication and the authorship of academic textbook in his area of expertise. Today, he will present about leadership in patient safety, building a strong safety culture in nursing practice. Without further ado, please join me in welcoming Professor Hadi, who will deliver his presentation for the next 20 to 25 minutes. Mr. Hadi, time is yours.
Atau mungkin bisa dibantu aja. Selamat pagi, good morning. Om Swastiastu, Namo Buddhaya. Kalau bahasa Thailand, Filipina apa tadi? Mabuhay, mabuhay. Sawadikap. Honorable Rektor Rektor ITKes Bali, Bapak Dr. Putu Darmasuyasa, Professor Kamolrat Turner from Thailand, Professor Virtuk Porsia from Sinpol University, dan juga tadi ada pembicara Ibu Nilu, Ibu Nita, ya. Tamu kita dari from Taiwan, welcome to Bali. Para mahasiswa, good morning. A special honor to the distinguished speaker from St. Paul University, from Prof. Portia, and special from Thailand,
Recording in progress.
Ibu Kamolrat Turner. Yeah. Today I will discuss transformative nursing leadership for safety excellence and integrated leader approach that protect patient, safeguard student, and sustain environmental safety. According to the World Health Organization, unsafe care affect approximately 1 in 10 patients globally and in low and middle income countries. And self-care contribute to an estimate 134 million adverse events and 2.9 million deaths annually. Leadership, therefore, is not merely administrative authority, it is a moral responsibility. When preventable harm occurs, it is not only a system failure, but a leadership failure.
Recording stop.
Safety excellence begin with ethical accountability.
Recording in progress.
Next slide. Oh, okay. Yeah. Slide 2. Okay. Healthcare safety is multidimensional. Harm can occur to patients, learners in clinical setting, and staff, and can be amplified by unsafe environmental. The WHO emphasizes that patient safety requires organized activities that shape culture, process, behaviors, and environmental. Meaning safety must be engineered and led, not assumed. Healthcare safety risks are systemic and multidimensional. WHO estimates that up to 60% of patient harm is preventable. Medication error alone costs the global healthcare system nearly 42 USD billion annually, such WHO. This reality demands leadership that anticipate risk rather than react to tragedy. Leaders and moral steward of system entrusted with human life. Next slide. Why nursing leadership matters? Nursing leadership matters because nurses operate at the point of care and influence how systems are applied in real time. The IOM's landmark work highlighted that harm often results not from bad people, but from good people working in flawed system. So leader must redesign process and support safe system. The Institute of Medicine estimate that between 44 and 90 10 did annually in the United States were attributable to preventable medical errors, number that likely underestimate that global burden today. Nurse operate close to patient and are central to surveillance, early detection, and escalation of risk. If leadership fail to empower nurses, the system loses its most sensitive safety mechanism. Leadership, therefore, must be protective, enabling, and ethical grounded. Next slide. Concept of transformative nursing leadership. Transformative leadership moves beyond supervision and compliance. It inspires shared purpose, empowers team, and create conditions where safety is a daily habit. WHO Global Action Plan calls for leadership and policy action that builds safer care across practice domain, making transformation a strategic necessity. Transformative leadership aligns organizational mission with safety ethic. WHO Global Patient Safety Action Plan call for zero avoidable harm as a global aspiration. To aspire to zero harm is not naive. It is an ethical declaration that every preventable injury is unacceptable. Transformative leader internalize this moral stance and translate into structured system. Next slide. Key characteristic of transformative leaders. Transformative leaders are value-driven, inclusive, and learning-oriented. They build psychological safety, encourage speaking up, and align safety with professional identity. They strive directly support the culture of openness and transparency that promote learning, not blame. Emphasis in global patient safety strategies and transformative leader cultivate psychological safety because silence in healthcare can be lethal. Studies show that organizations with strong safety culture are demonstrative significantly lower adverse event rates. Philosophically, leadership in healthcare is an act of guardianship. Leaders safeguard not only policies, but human
Recording
dignity.
stopped.
Next slide. Slide 6. Patient safety as a global priority. Patient safety is a cornerstone of quality. The WHO Global Patient Safety Action Plan provides strategic direction to eliminate avoidable harm, emphasizing system-wide effort, leadership engagement, and implementation at the point of care. Globally, unsafe care ranks among the top 10 causes of death and disability. WHO report that 4 out of 10 patients are harmed in primary and outpatient care, and nearly 18% of harm in this setting is preventable. When harm is predictable and preventable, leadership becomes a moral imperative, not an operational option. Next slide. Leadership in patient safety. Safety requires leadership behavior that make reporting, learning, and improvement possible. The IAM stress the need for organizational accountability and systemic approach to reducing harm. Leader must ensure the safety is governed, resources, and continuously improve. The IAM emphasis system redesigned as primary strategic for safety improvement. Healthcare must shift from a culture of individual blame to a cure of organizational learning. Leader must ensure transparent governance structure where reporting is protected and learning is institutionalized. Next slide. Building a strong safety culture. A strong safety culture is one where people can report risk without fear, learn from incident and improve process. WHO strategic highlight building openness and transparency, emphasizing learning over blame. Leaders set the tone. If leader punish reporting, the system become blind to risk. WHO highlights that learning system prevent recurrence of harm. Organization with punitive culture experience underreporting, limiting improvement. Leadership determine whether fear or learning become the dominant organizational emotional. Next slide. Element of a strong safety culture. Key elements include trust, transparency, teamwork, and learning system. This align with the IOM's call for redesigning care to be consistently safe and with WHO framing of patient safety as a structured framework shaping behaviors and environment. Trust, teamwork, transparency, and continuous improvement are foundational. High reliability organization demonstrative preoccupation with failure and commitment to resilience. Leader must model humility, the recognition that errors are possible and vigilance is perpetual. Next slide. Leadership style in nursing. Leadership style influence how team behave under pressure and how safely the work and safety critical industries, including healthcare. Leader must balance standardization with empowerment. The IM emphasis system redesign and reliable process, which requires leader how can drive change while maintaining accountability. Transformational leadership correlate with improved staff engagement and safety outcome. However, no single style is universally optimal. Safety leadership requires situational intelligence. Ethical leadership is not about control, it is about enabling others to act safely. Next slide. Leadership style and patient safety. Transformational leadership strengthens trust and engagement, important for reporting and improvement. Transactional approach can reinforce adherence to safety protocol. Authoritarian style may help in acute crisis but can suppress communication over time, undermining reporting. This is why just culture and openness are repeatedly emphasized in safety framework. Just culture framework balance accountability with learning. Evidence show that transparent reporting system increase early detection of risk. Authoritarian silent surfaces reporting. Empowered team surface danger early. Next slide. Chemists on leadership style. There is no universal best style. Safety leadership must be adaptive and situational, aligned with the goal of high reliability. The WHO Action Plan support system level approach that require leaders to build capacity, coordinate stakeholder, and sustain improvement over time. Sustainable safety requires adaptive, long-term leadership commitment. WHO emphasizes multi-sector collaboration and sustained governance engagement. Leadership must persist beyond short-term accreditation cycle. It must become institutional character. Next, effective communication in leadership. Communication is central to safety. Many adverse events are linked to communication breakdown, particularly during handover and interprofessional collaboration. Leaders must create norm for clarity, verification, and speaking up, because silence can become a safety hazard. GCI operationalize this targeted safety goal that requires consistent communication and verification. Communication failures are consistently among the leading root causes of sentinel event globally. Joint Commission International address this through the International Patient Safety Goal, emphasizing accurate identification, safe communication, and high alert medication safety. Leaders must standardize clarity as a non-negotiable safety expectation. Next, communication for patient safety. Focused communication included clear expectation, active listening, respectful challenge, and closed-loop confirmation. JCI's International Patient Safety Goal emphasizes critical practices such as correct patient identification and other high-risk areas that rely heavily on reliable communication. Closed-loop communication reduces ambiguity. Structure handover significantly reduces preventable error. And communication is not merely technical, it reflects respect for human life. Next. Practical communication strategies. Structure to improve reliability. SBAR, briefing, and debriefing reduce ambiguity and align team. In addition, leader must protect psychological safety so staff and student can escalate concern early. GCI standard and goal reinforce consistently and systematization of such practice in accredited organization. SBAR improve reliability across discipline. Briefing and debriefing promote shared mental model. Psychological safety allow early escalation, preventing escalation of harm. Next slide. Student safety in nursing education. Student safety is both an ethical responsibility and patient safety strategic. When students feel unsafe, physical or psychologically, learning is compromised and error become more likely. A safety-oriented system must protect learner as part of the workforce pipeline and the care team. This aligns with the broader system view of safety emphasized by WHO and IAM. Learners exposed to unsafe environmental experience increase stress and reducing performance accurately. Future workforce resilience depend on psychologically safe training environmental, Leadership must protect learners as future guardian of safety system. Next slide. Leadership role in student safety. Nursing leaders must ensure supervision, clear scope of practice, and respectful learning climate. Preventing bullying and creating supportive environment increase willingness to ask questions and speak up key condition for safe care. A learning culture is inseparable from a safety culture. Zero tolerance for bullying, improve learning, engagement, and safety behavior. Clear supervision structure, reduce role, ambiguity, and error risk. A safe learner become a safe practitioner. Next slide. Environmental safety and nursing leadership. Environmental safety is part of safety excellence. Healthcare was the management, infection prevention, and occupational safety protect patient, staff, and communities. WHO highlight that patient safety involves shaping technologies and environmental, so environmental safety is not extra. It is embedded in patient safety system. Healthcare contributes significantly to environmental waste and occupational exposure risk. WHO underscores that safety included technology, infrastructure, and environmental system. Environmental stewardship is part of ethical healthcare leadership. Next slide. Integrated safety approach. Transformative nursing leadership integrate three domains: patient, student, and the environmental through culture, communication, and continuous improvement. This approach supports WHO strategic direction to eliminate avoidable harm and align with IOM, and IOM call for the redesign system to reliably deliver safe care. GCI provide operational focus area through the EPSGS. The hub organization translate principle into measurable practice. An integrated model connect patient protection, workforce resilience, environmental sustainability. WHO provides strategic direction. IOM provides systemic redesign philosophy. GCI provide operational measurable standard. Leadership integrated this into life practice. Next slide, closing message. In conclusion, safety excellence is not achieved by policies alone. It requires leaders who inspire trust, enforce reliable system, and promote continuous learning. The WHO and IOM both emphasize system thinking and culture change. GCI provide practical goal-oriented standard to focus improvement effort. Transformative nursing leadership is therefore essential to achieve sustainable safety excellence. Safety excellence is not achieved by policy manual alone. It requires leadership who see safety as a moral covenant with society. Every preventable harm represents a breach of trust. Every improvement represents restored dignity. Transformative nursing leadership is therefore not optional. It is a professional, ethical, and societal responsibility. Thank you very much. Okay. duduk dulu atau sana? Oh, oke.
Thank you, Professor Hadi. Could you mind to sit next to me here? Thank you. Oke, silakan boleh. Okay, the next speaker, it should be Associate Professor Dr. Kamala Turner. And then I just want to make sure that Achan, can you hear clearly? Achan Ka?
Yes, I'm here.
Okay, okay. That is your time, please.
Thank you very much. Director of ITKS Bali, Professor Putu Dama, Professor Muhammad Hadi, honorable speakers, distinguished guests, Om Swastiastu, Selamat pagi, good morning, and Swadika. It's very my great honor to be here to share with you all about leadership and student safety. Today, I prepare 2 video clips. The first one, I will discuss about nursing leadership in ensuring student safety during the skill laboratories and clinical practice. That is in the leadership wheel. And then the second clip, if the time allow, I will show you about students will about student safety. So the representative of our student, she talk on the video about what they see extra about the safety. Thank you very much for inviting me to have a chance to share with you. It's very great opportunity. Please see what I prepare from video to ensure that the signal does not affect my presentation. Thank you.
Okay, thank you so much, Achan Ka. So, before we share and play the video clip from the Dr. Kamrat, so let me introduce her curriculum vitae first. Dr. Kamala Turner currently serves as a Dean of the Faculty of Nursing at Prabowo Marachanok Institute. She earned her PhD in nursing from the University of Newcastle, Australia. Her areas of expertise include innovative nursing education, particularly active learning approaches, teaching for creativity and 21st century skills, curriculum development and evaluation, AI, integration in nursing education, leadership, and the management. She actively contributes to the advancement of the nursing profession as a board committee member of the Thailand Nurses Association. She has received several recognitions and research grants, including funding from the National Research Council of Thailand and internationally. So the topic will be shared with the IT or the team for the first video clip about her topic today is nursing leadership in ensuring student safety during skill laboratory and clinical practice.
Chair of the International Seminar Committee, executives, respected colleagues, and distinguished guests, good morning. First of all, I would like to express my deepest gratitude to the host and steering committee for inviting me to speak at this international seminar on nursing education and practice. I sincerely appreciate this opportunity to share perspectives on an issue that is fundamental to both educational quality and healthcare outcomes, which is student safety. When we talk about safety in healthcare, we usually think first about patients, where patient safety is undeniably essential. Today, I'd like to draw attention to another critical yet often receives less attention: the safety of nursing students. Nursing students are in a very special position. They are still learning, but they are already working in real clinical environments. They care for real patients, use real equipment, and face real risks. If students are not safe, learning becomes difficult, and patient safety is also affected. Importantly, student safety does not occur by chance. It does not depend only on how careful students are. Student safety depends on leadership. It depends on how nursing education is planned, supported, and supervised. In this presentation, I will focus on three main points. First, the conceptual framework of student safety in nursing education, or what student safety really means in nursing education. Second, the role of nursing leadership in protecting students during clinical practice. And third, how we can prevent incidents and encourage students to report safety concerns. For the first point, the conceptual framework of student safety in nursing education. Let us begin by answering a simple question. What do we mean by student safety? Many people think student safety means only physical safety, for example, avoiding injuries or infection. Physical safety is important, but it is only one part of it. In fact, student safety has several dimensions. First, physical safety. This includes risks such as needle stick injuries, exposure to infectious diseases, and injuries from or moving patients. Second, psychological safety refers to student emotional well-being. Students may feel afraid of making mistakes. They may feel anxious about being evaluated. Some experience stress, burnout, or even bullying. In some cultures, students are taught to respect authorities and not question supervisors. Not be asked to perform tasks they are not trained to do. They should always be supervised. They should not be treated as staff members who must fill workforce gaps. And the last one, environmental safety. This includes safety skill laboratories, enough equipment, proper supervision, and safe clinical settings. When we look at all these dimensions together, one thing becomes clear. Student safety is not the responsibility of students alone. It is the responsibility of the education system and its leaders. We can think of student safety as being supported by three pillars. The first pillar refers to systems and policies. These include clear rules, clear student roles, and safety procedures. The second pillar is the learning environment. This includes skill laboratories, simulation training, and clinical placement. The third pillar is leadership and safety culture. Leadership influences how safety is understood, discussed, and practiced every day. We can say that leadership connects all these three pillars. Without leadership, safety systems do not work, believe me. Next, I would like to focus on the second point, the role of nursing leadership in protecting students during clinical practice. Indeed, leadership affects student safety before, during, and after clinical practice. Let's look at leadership before clinical practice. Before students enter the clinical area, leadership decisions have already been made. Nursing leaders must make sure that students are properly prepared. These include safety orientation, infection control training, clear explanation of what students can and cannot do it, and simulation practice before working with real patients. For this, skill laboratories are very important because simulation allows students to practice safely, make mistakes, and learn before entering the real clinical environment. Sending unprepared students into clinical practice is not just an educational problem. It is a leadership problem too. Let's look at during clinical practice. For this, leadership is seen in supervision and support. We need to make sure that students now should know who is supervising them, who they can ask for help, and what to do if something feels unsafe. Therefore, supervision must be available and supportive. Psychological safety is especially important at this stage. Students must feel safe to ask questions. They must feel safe to say, I don't understand, or I'm not ready. In many Asian cultures, students may not speak up because they are afraid of appearing disrespectful. Leadership must actively encourage them to speak up. Silence does not always mean confidence. Very often, silence means fear. Letting now move to ethical leadership. This issue is also very critical. We all must remember that students are learners, they are not workers. They should not be used to replace staff shortages. They should not be pressured to perform procedures beyond their ability. We also need to note that leaders teach values not only by words, but by their action. How about after clinical practice? Leadership responsibility continue even after clinical practice ends. Students need time to reflect on their experiences. Debriefing sessions allow students to talk about what went well and what was difficult or what not correct. Near misses are especially important. When we talk about near misses, we can prevent future harm. Students also need emotional support. Clinical practice can be stressful and sometimes frightening. Ignoring this stress can affect students' future professional behavior. May I remark that good leadership turns experience into learning. Next, let's look at the third point: student safety, incident prevention, and reporting. Even in good systems, incidents can happen. The important question is whether students report them. Many students do not report safety incidents. Why? They may fear punishment. They may fear poor evaluation. They may believe that injury is part of training. They may not know how to report. In hierarchical cultures, these fears can be even stronger. When students do not report incidents, leaders cannot see the real risks. Do you think so? Without information, systems cannot be improved. An effective student safety reporting system must be non-punitive, confidential, easy to use, and separate from academic evaluation. Leaders must clearly communicate that reporting will not negatively affect students, academic or professional prospects. Ensure them that reporting will not harm your grades or your future. Furthermore, students need to see that reporting leads to improvement, not blame. We must establish a good safety culture that focuses on learning, not punishment. Reporting is not a problem. Reporting is a gift. In conclusion, I would like to leave you with three key messages. First, student safety is a leadership responsibility. Second, safe learning environments create safe and competent nurses. And third, effective reporting systems strengthen safety culture. So, if we want safe patients tomorrow, we must protect nursing students today. That's all I'd like to talk about for today. Thank you very much for your kind attention. And if you have any comments or questions, I will answer you later. Thank you.
That is the first video clip. And the second one is about the durations, around 5 minutes, about the students' opinions about the patient safety.
Hello, my name is. Hello, my name is Tanuman Sasato, President of the Student Union of Faculty at Kabul National Institute. สวัสดีค่ะ ดิฉันพระมวลศักดิ์เสโชคนายกสโมสรนักศึกษาคณะพยาบาลศาสตร์สถาบันพระบรมราชชนกขอต้อนรับทุกท่านเข้าสู่การบรรยายเกี่ยวกับความปลอดภัยของนักศึกษาหรือ Student Safety ที่ทางสถาบันพระบรมราชชนกได้มีการจัดขึ้นเพื่อส่งเสริมและป้องกันความปลอดภัยของนักศึกษาค่ะ Today, I would like to present a topic of critical importance to higher education institutions. Student safety is an area that requires continued development, systematic planning, and sustainable institutional commitment. Within our institution, student safety is promoted through structures, educational program, and preventive initiatives. The overarching objective is to equip students with the knowledge, awareness, and critical competency necessary to protect themselves, make informed decisions, and maintain safety in all aspects of campus life. Safety awareness on phone scam and call center fraud. The first initiative addressed the growing twist of telephone scam and call center fraud, which represent significant risk to student financial and personal security. To mitigate this risk, the institute collaborate with law enforcement officers and relevant authority to provide formal training session focused on processes for reporting incidents of ethical channel and emergency hotline, identifying running signs of fraudulent activity and appropriate response stages in suspicious situations. Fire safety training in educational settings. The second initiative involves comprehensive fire safety training aimed at training both theoretical understanding and practical emergency security learning objectives include prevention of fire-related safe education procedures and correct operation of fire extinguishers and emergency equipment, ethical and responsible use of artificial intelligence. The final initiative concerns the ethical intelligence of artificial intelligence in academic work, training empathy and student must use AI technology creative and productive in accordance with academic integrity principles and without violating copyright or intellectual property rights. From the student perspective, safety should not be perceived and isolated. Training event issues should be conceptualized and a comprehensive and continuous support system that compensates physical safety, psychological well-being, transportation security, and digital protection. Then believe that sustainable safety is most accountable than institutional activity. Encourage student participation, thus collaborative engagement between institutional leadership and the student body can cultivate a learning environment. This is academically excellent, physically supportive, and physically secure. Thank you very much for your attention.
Okay, thank you so much, Achanka, about your topic today because you combine it for the ensuring the student safety and the application by student opinion in your institution in Thailand. So the next panelist, it should be the third speakers. Professor Vitu Porcia from St. Paul University, Philippines. Let me introduce her first. Okay. She brings extensive expertise in the environmental health, particularly how environmental factors influence health promotion and patient outcomes. She is passionate about creating innovation in nursing practice through integration of new knowledge and information. Given his area of expertise, it is not unexpected that he was authored numerous publications and attended international conference. Currently, she is the founding president of the Philippines Nurse Environmental Organization and chairperson at the Committee on Advanced Practice Nursing Philippine Nurses Association. Her topic today is transformational nursing leadership for environmental safety. Professor Porcia, time is yours. Okay, giving applause from the students to Professor Porcia. Thank you.
Okay, thank you very much. Good morning, everyone. Before sharing my presentation, I would like to thank and congratulate the organizer. Thank you for inviting me. Of course, Dr. Puto as the head. Mr. Mata is there a while ago. And Dean Mary, Mrs. Agung Yuli. Thank you. Faculty members, I can see them. Then, of course, the students in Etiquette Valley. Of course, the distinguished guest, Dr. Hadi, Dr. Kamalrat, and Miss Lu later, after me. Okay, I was in charge to talk about transformational leadership in environmental safety. So, I would like to introduce first what is transformational leadership for everyone. Next slide, please. According to the many management book, leadership and management book, it promotes employee development. If we are talking of transformational leadership, attends to needs and motives of the followers, inspire through optimism or positivist, influence changes in perception, provides intellectual stimulation, and encourage follower creativity. So the next slide would be the key feature. This is just a summary of 100 books and journals that I read. The key features about transformational leadership. Next slide. So this is the summary. So for transformational leadership, it is networking and not hierarchy. Asian country likes to have the hierarchy in the management, but in transformational, it's networking. Another key feature would be cooperative or cooperation rather than competitiveness. So we need to work together. That's very important if we are talking of transformational leadership. So process focus then task focus. Okay, so transformational leadership would be, of course, it was mentioned already about the patient safety, the accreditation, how are we going to do that? And it has something to do with the task focus they are talking. So your task is this, your task, but in transformational leadership, we need to know the process. We need to know the holistic, whether we are talking of patient, your teacher, the student, it should be holistic approach. It should be task focused. So another key features is promote employee or students development rather than exchange benefits or position. The hierarchy I am talking about is more on the position, but in transformational leadership, it is our development, whether you're student, teachers, or the leaders in your institution, it's about our development. Another key feature is attends to needs and motives of followers rather than identity needs of the follower. So we must be together to know the needs, to know our goal, because transformational leadership, as I mentioned, networking, and that is team management. Okay, next slide. Another key features. Next slide, please. It's individualized consideration rather than dictate goals for employees or for the students. Okay, so it means that right now in the Philippines, back when in the Philippines, our curriculum is not competency based, meaning competency, you do a lot of skills like that. It's a competency of being a nurse, being a student's nurse to future registered nurse. But we change in the outcome based curriculum. So that is the curriculum of nursing in the Philippines right now. Why? Because we need to know the individuality of our students, and not this is the mission and vision of the school. No, it's not like that. Or in the future, you will be a registered. It should be an individualized approach if we are talking of transformational leadership, because individual is different from each other. We need an individual strategy on how are we going to approach individual. So we need to individualize and not just to touch the individual and feel the belongingness in our institution. Another key feature of transformational leadership is provide sense of direction rather than focus on day-to-day operation. So it is more on visionary rather than this is what I'm going to do today. No, you have to focus on the vision. It's a teamwork so that our institution will be successfully maintained and really imbibe the vision and the mission of each institution. That is transformational leadership. Another key feature, I think this is the last slide for the key features. Next slide, please. Yes, encouragement of self-management rather than management by exception, or encourage workers, students to develop their potential and help them meet their needs for recognition, accomplishment, and sense of belonging. That's why in the Philippines, we do have what we call the outcome-based to individualize our approach to our students. If we do have 100 to 200, we do have an individualized approach to each student, because that is transformational leadership. We want to understand, we touch the heart of our student, and for our patient, it's very important for you to individualize your patient in the future. Very important, because your patient can feel pain different from mental health. It's different from sick, like a simple fever. The different patient in the hospital. That's why you need to take care individualized, and that is transformational leadership. And next slide. Oh, it's another key feature. It's provide intellectual stimulation rather than contact mutual benefits, influence change in perception rather than exchange for expected performance, and of course, the most important, you will be the role model rather than the caretaker if we are talking of transformational leadership. Next slide. So, okay, I said that optimism already. individual success. And this is very important. This is a classic book, Mary Foley. She is one of the first female leader during the 1800s. And according to her, nurse managers should advocate studying the total situation to achieve unity, because she believed that control would be obtained through cooperation among all of the elements of people and materials. Materials would be your paraphernalia, or the equipments in the hospital, the equipments in the school, whatever it is. But the transformational leadership is really something about during the 800s already. It was defined of she's the second, actually, the second female leader during the 1800s, Mary Foley. Next slide. And this is the topic that was given to me, environmental safety within the context of professional nursing practice. Next slide. So I'm not going to talk about academe. It was being said by Dr. Kalmarat. Clinical setting, that was Dr. Hadi. She mentioned about JCI. So the key feature for the clinical safety is really coming from the accreditations in the hospital. And I'm not talking about that. And self-safety later, it's Miss Nilu. But me, I think because this is the concept of environmental health. The focus of environmental is so big. We can talk about academe, university, or classroom. We can talk about clinical setting in the hospital, but they can talk about the patient itself or the nurse safety itself. It's about environmental health. But right now, I'm going to focus on community setting. Okay, it was not mentioned because I don't want to be repetitive to talk about the school, because it was taken already. And me focus on community health. Next slide. Let me just show you some statistics in relation to environmental health factors that seeing the status of Indonesia and Philippines. This is just some, okay? So Indonesia and Philippines in environmental health. So climate change is very vulnerable, and natural disaster. Philippines ranked first globally, 24 and 25 World Risk Index. It faces intensifying because we do have many typhoons. I know in Bali, you don't have typhoons. Unusual heat because we experience severe heat in the Philippines. So that's climate change, linked to which reached record levels in early of 2025. Then in Indonesia, I searched about faces massive displacement from catastrophic flooding and landslides, with nearly 1,000 deaths recorded in late 2025 following torrential rains in provinces like, I do not know, Aceh, am I right? Aceh. Thank you though so much. And West Sumatra. Okay. Next, of course, air quality crisis is a very key features when we are talking of environmental health hazard. So in the environment, whether I am talking of community, whether I am talking inside this room, we have air quality crisis. Air pollution is leading the cause premature death both countries, largely due to fossil fuel of combustion and open burning. So Indonesia often record highest PM 2.5. PM is a particle. It is a particle of smog. What is smog? It's like a fog. It is in the air that you cannot see because it's very small. You see, the size is 2.5 and you can inhale that one. So if you inhale lots of PM matters in the in our environment, even inside or outside, it can cause cardiovascular. It connected to cardiovascular diseases. So that is the connection of environmental aspect in environmental health. So Jakarta, look at that. Pollution level frequently exceed WHO guidelines by 6-fold, potentially reducing life expectancy by over 5 years. In the Philippines, air quality worsened in 2024, and still the same with you, we do have 2.5 PM matters level, reaching nearly 3 times the WHO annual guidelines. Major sources include vehicle emission and continued use of solid fuels by roughly 53% of the population from cooking. So I think it is my goal to educate all the household, the community in the Philippines also. Because I'm a founder of the Philippine Nurses Environmental Association or organization, and we call ourselves as environmental health nurse. So that is my mantra. So look at this one. I am just talking of air quality crisis. The next one would be, next slide please. Plastic and marine pollution. Philippines and Indonesia, we do have many sea, right? However, often cited the largest country of oceanic plastic. Kawawa naman yun. It's very prominent that our sea creatures are very poor. If we are talking of oceanic plastic waste, we do have the Pasig River in Manila, alone depositing tens of thousands of tons annually. So that is something like in the plastic or the garbage. Indonesia ranks the second largest producer of mismanaged plastic waste in the Asian region. So both Philippines and Indonesia, I think we do have a problem in the waste segregation, and it has something to do with environmental hazard. So we need to take on this one, because that will be the start for transformational leadership. Next one. Next slide. Water has something to do with environmental key feature, and it causes also a hazard. So water insecurity, climate change is exacerbating a mounting water crisis in the Philippines, with projection of high water shortage by 2040. Sanitation gaps, while improving a significant portion of both populations, still relies on improved sanitation. In the Philippines, roughly 15,000 deaths annually are attributed to poor water, sanitation, and hygiene. Next slide. So the vector-borne diseases is rising. Both of us are very prominent in dengue, and we just visited one of the village in partnership with Etiquette's Bali. I was there last Monday, and they told us it's rising a dengue case here in Indonesia. So both countries have seen record spike, and Philippines dengue cases increased 94 in early 2023 and remained endemic and high levels. It's expected because we are both a tropical country. Okay, next slide. About the disease burden and environmental factors, is pollution deaths in Jakarta. It caused so much stroke and respiratory diseases like pneumonia, influenza, that are leading causes to the death, with pneumonia surging by 48% in 2023 due to the poor air quality. Okay, thanks for Bali. You have many trees. Do not cut trees, please. Protect that, nurses. Environmental health nurse in the future. Please protect your Mother Earth. Okay, neglected tropical disease. In 2019 data, Indonesia recorded as much higher absolute death count from these diseases. You see 11,029 compared to the Philippines of 2,870 when it comes to disease burden or environmental factors. Air pollution, roughly 66,000 deaths annually in the Philippines, and in Indonesia, severe enough to reduce the average life expectancy by roughly 1 to 2 years. So that is the effect in Indonesia in relation to air pollution. Next slide. So this is the definition of environmental health. It refers to the theory and practice of assessing, correcting, controlling, and preventing those factors in the environmental that can potentially affect adversely the health of present and future generation. This is very important. Please listen, BSN, the nursing students. Why? Because this is your future direction. The future generation really, the environmental hazardous is really affecting your age. So nurses need to know about impact on physical environment, on health, because it affects the individuals, the family, communities, and population they work with. Next slide. So the role, what are the role? This is, I think, the third part that was given to me by the organizers to talk about the role, how to merge, how to combine transformational nursing leadership in promoting environmental safety. Okay. So our role, every nurse and even student nurses should be able to consider environmental factors that may be contributing to poor health. Just like what I said, it's air pollution, water pollution, noise pollution, and other kinds of, you know what, here in inside, if we are talking of physically, the old woods can cause asbestos. They produce asbestos. And asbestos is part of environmental health hazard that is really detrimental in our lungs. So that is environmental health nursing. You should know the chemicals that is really related in environmental hazard. And that is environmental health nursing. The second one, you have to understand environmental hazard and their impact to health. Perform an environmental assessment, just like I said, even inside the classroom, even in the hospital, there would be an environmental hazard, and you need to assess the environmental hazard. And another bullet, understand the role of individuals, communities in providing good stewardship of the environment. And I hope in the future that there would be an Indonesian environmental health nurse. Okay, not only in the Philippines. But I'm talking to Dr. Puto if she wants to replicate my Philippine Nurses Environmental Organization to Indonesia. So we will start here at Etiquette Bali to talk about environmental health nursing, or Indonesian organization about environmental health. So make recommendations about how to reduce or prevent exposure to environmental hazard. Next, please. Next slide. Then about the transformational roles. So this is I think the main assignment that was given to me. How are we going to do a transformational role to protect the environment? Of course, number one, nurses are the largest profession anywhere in the world. For your information, we do have the largest work group in healthcare. Working together, we can be a powerful force for making improvements in environmental safety. My number one goal is always protect the Mother Earth. Okay. Develop and implement school, hospital, office base, and workplace, and even the wellness programs in environmental safety. I think part of the accreditation would be to have this kind of standard operating procedure for your wellness programs in environmental safety. I just want to emphasize a wellness program because part of environmental health nursing is for us to be able, the nurses, the community, the students, be healthy in our institution. or in our community, we must be healthy. It is very important, the wellness of the nurses or the healthcare team. Why? Because we are the one who's going to take care of our patient. How are you going to take care of the patient in the future if you are not healthy? So I think you need to have wellness program, part of environmental health, and transformational leadership in thinking of all of us, not only students, but also the faculty. Aid in the formulation of public policy and legislation involving environmental safety is part of transformational leadership that we can contribute in our country. Okay, we can be the voice in our government to provide environmental safety. Next, please. And this is my last slide, and this is coming from me, and it will be safe to say that the focus of treatment and management of disease of both health personnel, students, and our client in the future should involve the call for the protection and caring for environment. Thank you very much.
Thank you so much, Professor Porcia. Could you mind to join with us here? Yes. Okay, for the last speaker, this is our last speaker, our last panelist. It will be Nurse Luh Gedenita Sri Wahyuningsih, SCAP MM, MCAP. So she's a lecturer of Bachelor of Nursing program. She earned master degree in nursing from ITKS Bali and master degree in management from University of National Education. Her expertise is in the nursing management, and she has publication in the National Accredited Journal. And several books have been published as well. Okay, Miss Nita, or Ibu Nita, could you mind to the stage? Her topic today is building a culture of self-safety, from awareness to daily practice. Okay, time is your Ibu Nita.
Okay, thank you for the time, and good afternoon, everybody. I hope still enjoy and relax for this seminar. Okay, I am the last speaker. Maybe I need 5 until 10 minutes for sharing discussion. Previous speaker have already a lot of safety, patient safety, student safety, and environmental safety. And now I will to focus how to be building self-safety culture from awareness to be daily practice. Okay. Worker safety, especially in healthcare facilities, is the foundation of patient safety and quality of service. Healthcare workers operate in high-risk environment, exposure to infection, physical injury, psychological stress, and work fatigue. Health worker is not only service provider, but also the most component of healthcare system. When the physical and mental are good measurable, to care or provide the patient will be safer, more effective, and higher efficient. But if the physical and mental is not good, is not enjoy, is not relax, will be increase more risk, more defect, more mistake to provide service to the patient. So the patient, there is not patient safety without self-safety, without staff safety, and without health worker safety. And next. Before we discussion about step how to building safety culture, we must know this concept, safety and safety culture. Safety is conscious effort by individuals to protect themselves from physical, biological, chemical, ergonomic, and psychosocial hazards in the workplace. Maintaining safety is not only at workplace, but everywhere we can do. But begin at home as the daily living habit. Safety is the personal responsibility to reflect it, aware of safety, and then be to create a preventive from all this stuff. At home, we do safety with take your body, example, personal hygiene, eating healthy food, exercise, and what do you want to activity? Do you want activity make you happy? At least your body is an unity, so we can take your body with enjoy and relax. Next, so start the safety from ourselves, myself, in yourself, not need to intervention with everyone, so we can do have ability. And then the difference between safety culture and safety culture. So safety culture in general and safety culture focus in individual, but them is interrelated focus to effort create a safety work environment. But they have a different focus. A safety culture focus in organization, but safety culture focus in individual. Together, them form a unity to determine effectively safety implementation in workplace and everywhere. Next slide. Okay. Why is culture of safety is important? If implemented, safe working environment, increase productivity, improve job satisfaction, improve patient safety. If not implemented, increase workplace injury, exposure to infection disease, burnout and fatigue, clinical error, and decline in service quality. All up done indirectly to performance health worker in workplace. Next slide. This is a type of personal safety risk in workplace. Example, biological, blood, body fluids, impact nosocomial infection. We can protect about that with complete PPI. And physical, there are slippery floors, needles, and impact puncture wounds. Chemical, disinfection, cytosolic drug, and we can poisoning. And psychosocial. Psychosocial is not problem personal, but to management problems. It's not easy, but this is indirectly all of body has be nurse, has be student, because no everybody needs to relax for do anything, for do good anything. Maybe you can do for release your stress. You doing what do you want? What do you make happy? Example, you child with your parent. You are dancing, you are singing, and the center. And next slide. Okay, this is a point in this discussion. Yes, state of building culture safety. Number one, awareness. So individual become aware of potential hazard in the work environment and everywhere, at home, at school, at university, everywhere. And stick to understanding. Good understanding about safety is a characteristic individual to viewing safety is integral part of life and work. So we can good understanding about safety. Strategies management to implementation safety in hospital, example PPI training, simulation of risk situation, and clear use the SOP. Next slide. And step 3, commitment. What we can do, we have a commitment. Just not in your relationship with your best friend and special friend, but in safety we need a commitment too. Commitment to start from how to you keep a safety. And step 4, practice consistent practice. The safe behavior repeat. Example, wash hand before every procedure, wear gloves, and use proper body mechanic. Next slide. And step 5, build culture. Make a daily activity, make the what we do can safety as a culture. Characteristic mutual reminder, no same is wearing PPI and open incident reporting in hospital actually. Okay, this is a pillar of safety culture. Number 1, risk aware. And procedure compliance and open communication. Communication is important everywhere. Open communication increase the information for most patient. Mental health. To keep mental health still happy, still enjoy, so we can do activity. We can do good activity. Team support, because we hard worker, we can collaboration, implementation, care provide to patient. And the last, exemplary leadership. Okay, next slide. Common obstacles. Number 1, high workload, lack of PPI, blaming culture, it's okay mentality, and then time pressure. And management have a solution is a continued education, management support, and non-punitive system. Next slide. Okay, implementation strategy for do a safety culture. Number 1, individual level, and team level, and the last organization level for support anything rules or SOP or procedure to provide to patient. The last, leadership role. Next. Okay, success indicator safety patient. Safety culture is number 1, decrease in work injury, decrease in needle stick injury, increase in PPI complaint, increase in incident reporting, and then increase in job satisfaction. Okay, the last slide. The last slide, safety culture is not just a set of rules, but a transformation of mindset, mind, body, and soul, one of unity. You can do self-safety culture. From awareness, understanding, commitment, consistent practice, to becoming an organization culture. Safety starts with yourself, myself, and yourself, and ourselves. Okay, thank you for the time and attention. The moderator will continue the agenda. Thank you.
Okay, thank you, Ibu Nita, for the last speaker. Could you mind to sit behind with us here? And then the last speaker highlighted that the many stages and many pillars of the self-safety culture. So you have to remember all those of the pillar and the stages. Okay, thank you so much for all panelists or all speakers for your valuable presentation today. And now we would like to open the floor of the questions and answer session. So maybe because we have two on-site and the online, so I would like to give the opportunity to the participant in the convention hall first. So you can ask the questions, maybe up to 2 questions from you in the convention hall. And then later on, we will continue to the Zoom meeting or online. So could you mind to, if you have any questions or comments or clarifications about all of the speakers today, you can raise your hand and then come to maybe Bapak Hadi, Bapak Eddie, do you have a, okay. Any questions? Okay, the first questions come from the students. From the right hand. Okay. Yeah. Maybe please, microphone please. Please introduce yourself first. Okay. By mentioning your name and your study program, for example, and your questions. And with whom do you want to like to ask? Okay.
Okay, thank you. My name is Anya. I'm from nursing major. So I wanted to ask to Miss Nita, and I have one question about self-safety and self-safety culture that Miss Nita said that healthcare is a high-risky job. So because the high risky job that is can cause the more like can caused by overwork that got stress or depressed. So that you said that it can solve that problem by spending time with family or friends or doing what we like. But sometimes health workers can work more like 24/7, so they can got a few days off. Even if they got a few days off, it's still too little to spend their time with family, friends, or doing their hobby. So the question is, so how to implement the strategy with that condition? Thank you. And I'm sorry if my English is not that fluently. Thank you.
Okay, but it's good, right? Thank you. How can I address you? How can I address you? Your name, please?
I'm Anya. Thank you. Anya.
Anya.
Yeah.
Okay. So sorry. Okay, Anya, that is the first question. Maybe the second question, maybe? Okay. The behind? Yeah. In the back. first questions for Ibu Nita, and then the second question. Okay.
Okay, so thank you so much for the opportunity that you've given me. So good morning, everyone. My name is Saras. I am a second-year nursing student from Class B, and I would like to ask for the third speakers. So here are my questions. So considering that Indonesia doesn't yet formally recognize environmental nurses, how can transformational nursing leadership through networking, cooperation, process focus, and staff development be used to prepare and strengthen environmental safety practices in Indonesia healthcare settings? Those are my questions, so thank you very much.
Okay, thank you. That is your question is for the all speakers or the third speaker?
So for the Professor Portia,
Okay,
please.
the third speaker. Okay.
Thank
Did
you so
get
much.
it? Okay, okay. Maybe diverse? Oh, okay. Okay, Ibu Nita first. To answer the questions from the Anya about the high risk job, right, for the health worker. So they have like a stressing, and then even though they have a day off for her work, but they didn't like much work, right, for this one. And how the strategy to complete it, to face it.
Okay. Thank you for the question. And strategy are implemented to address various issue in yourself, especially safety culture as individual and proactive nurse. Maybe you can do what you like for the first, because becoming a safety start from ourself, myself, yourself. Make your body is enjoy, relax, do anything what do you want, do anything what do you like, and external trouble, external problem, you can release a step, one step, gitu. But in management hospital, which one strategy for release the problem as a nurse is in shift time in hospital. So in one month, have 2 until 4 until 10 pre-day for nurse especially. So pre-day nurse can do recreation or spending time with family and catching time with a friend and the others. Okay, thank you.
That is the answer from the Ibu Nita. So is it clear for you, for your questions? Oh, okay, okay. The next
Yes.
questions
Oh,
from
thank you
Professor
very much
Portia.
for the question.
Please.
What is the name of the student?
Some
Sorry.
information
Yes,
from
yes, of
Thailand
course.
about
Achanka.
the risk from working too long hours. Like in Thailand, we have this problem too. And then the Thai Nursing Council have set the regulations for the limitation of hours that they can work per week. So that can help. But anyway, it depends on the nurse themselves too. For example, the Thai Nursing Council have set the regulations that 1 week they not the organization cannot ask them to work more than certain hours, but then outside their workplace they might take like extra works that depend on their responsibility. So I think if we set this for the organization, that will help. And then we have to inform all nurses about the duration of work that they should do per day or per week. Because in Thailand, we have evidence that a nurse, one nurse worked so hard and then she already got some health problem, and then she has passed away. That's a shame. That's what I like to add into your question. Thank you.
Thank you so much for your additional perspective, Achanka. So that is all the additional knowledge from the Achanka Morat for the first questions. Okay, for you, Anya. And then the second one, could you mind to add?
Yes, for
the second
environmental health, thank you very much for that question. How our Indonesian will adopt environmental health since it was not introduced yet in Indonesian culture? Well, I think this is the legacy. I was able to talk to Dr. Puto and Dr. Ahid right now that I hope that you can adopt the environmental health nursing in the future. Okay, the second one, Philippines, then Indonesia. And I think how are you going to incorporate the learnings or the topics of environmental health hazard? It's so easy. Each subject of the nurses, okay, in congruency model that I made in environmental health, it has very special components, which is the 7 environmental principles. The 7 environmental principle in my study is connected to all the subject that you have. Let's say, for example, everything is connected elsewhere. That is the number one of the 7 environmental principle that I can connect to your pathophysiology. Everything is connected elsewhere. Even in the simple recycling of your trash. Okay, that is very simple to add on your practice and even in theories on how are we going to put the garbage properly to answer whichever the disease is respiratory, cardiovascular. Let's say cardiovascular. How are we going to connect that in your subject? I talked about PM matters a while ago, and PM matter has something to do with the pollution, with the air. Okay, so how are we going to do that? Okay, so by teaching or coming from ourselves first, the proper of carbon dioxide reducing emission. How are we going to reduce the emission of carbon dioxide? Because you have motorcycle here, you have very large the vehicle in Bali, but how are we going to protect and combat the PM particles? It's so simple, by planting plants, because 1 million plants could save the community in Bali. So we need really to save the environment equally to the good health of the population all over the world. So I hope that I answered the question. And for the additional answer for the first question, I think I mentioned the wellness program. I think wellness program will help students, teacher, or individual of us to those kind of stress to be answered, to reduce stress, to reduce problems. And I think wellness program is very important in each institution. Thank you very much.
Thank you so much for Professor Porcia. That is a simple one, right? The plant, the tree, or something like that, to release the stress and then yeah, that's why the plant the tree and then to release the stress. That is the simple one to you for the septic culture. So we would like to, for the second, Saras. That is the answer from our third speaker. How are you? Is it clear for you, or do you have clarifications? No? Okay. Thank you so much, Professor Porcia. So we can move to the Zoom or chat room, but there is no question, right? So I think all of the participants in the Zoom meeting that is all agree, and then the knowing about the patient safety, student safety, and the environment safety, focusing in the entering the transformative leadership in nursing. So maybe we have time 5 minutes. So I just open one questions from the maybe in conference hall in the participants in here, maybe from the faculty members. Yeah. Professor Portia asked the faculty members. This is one question from the faculty members. So who want to ask the questions? Or maybe that it should be not questions or comments or clarification, it's okay. Okay. Okay, Arya. Bapak Arya or Mr. Arya, right? Okay. Okay, wait a minute, please. Microphone will be. Okay.
Okay, thank you, Ms. Mary, for your time. Okay, thank you for our distinguished speaker for today. It is very insightful for us for new information about the leadership and patient safety. Maybe my question is straight for the Prof. Hadi because I want to know about leadership and management of patient safety. Prof. Hadi, we all know that in 2020 until 2025, until now, we have already viral issues about the malpractice from nurses. Viral di sosial media tentang bagaimana perawat itu dibentak oleh keluarga pasien. So that's my point. That's my point now to ask you about what the role of leadership to prevent malpractice in nursing care. Could you please give your perspective? Thank you.
Okay, the question from Bapak Arya is about the malpractice, right, in the nursing and how the role of the nurse. You mean right? Yes, nurse leaders in the practice. Okay, that is will be. Professor Hadi will be answered later on, and then maybe another questions. Maybe do you have another questions from the students? Ada pertanyaan?
Maybe if you can give me maybe if you give me a chance for one question again.
Oh, okay. You had two questions, right?
Okay, thank you.
Okay.
Thank you very much. Maybe I want to state the question from Prof. Sia.
Okay.
It's very interesting about the environmental health. You know? When you say that we have to taking care or we save the Mother Earth, I feel goosebumps now because we have same perspective about that. We know that human now to be a destructor our Earth, right? So I think this is need more awareness for our people to save our Mother Earth. And my question is, in Bali we have a problem about waste management. So I think in Philippines they have same problem. So in your perspective, or based on your observation or experience in Philippines, could you give us what they do? So what the government do, people do in Philippines to waste management? Thank you.
Okay, thank you so much for the second question from the Bapak Arya to Professor Portia. Did you get it? The point? Okay. And then Bapak Hadi, jawab dulu.
Okay, thank you, Mr. Arya. This incident in clinical area is about a communication for nurse and family, family of patient. But leadership is very important in clinical area, but it is a role of a nurse leader in practice. The role of nurse leader in clinical practice nurse leader in practice is critical because it directly influences patient outcome and staff performance and the quality of nurse care. Care role include clinical leadership, patient safety and quality improvement, and team coordination and collaboration. But communication about nurse and family and patient is very important. Yeah. Key as the all key is communication in clinic. Yeah. I think it's very, very important, and the role leader can menjadi contoh the role model as a role model in clinical area. It is maybe I think it's very powerful to pembaruan change agents in clinical area. Thank you.
And can I share experience from Thailand
Okay, Kak
about
Ajan.
the patient safety and prevent like the falls of nursing care? I think like if we have the guideline that will help guideline. So if every ward has the guideline about some things, especially the procedures that are more complicated, and also any guideline to help, especially new nurses. And for the new nurses, I think the nursing school has a big role for patient safety, because as I said, mentioned in my slide, that patient safety will be enhanced if we start from student safety, because we have to make sure that our students has enough competence to make patient safety. And if we're not sure, the guideline will help. So I don't know if in Indonesia, every ward or every hospital has provide nurses for guidelines that they can follow. Thank you.
Okay, thank you so much, Ajan, for your perspective for the first question from Bapak Arya. So we can move to the second question from Professor Porcia, please.
Yes, the practice in garbage disposal. Okay, in the Philippines, and I think here I observe in Indonesia, you segregation. Okay, number one, segregation. That's very important. However, the problem is the practice. They do not know how to segregate. So I think education is very important. The Philippines practice is that we do have the schedule in the household to get first, there is a schedule, different schedule for recyclable and non-recyclable. So that's the practice that we do have in the Philippines. The third one is determining the land that is not used anymore, that can be turned into dump site. A safe one and far from the household chores or any kind of factory. So they are doing mapping of the land for the waste disposal that is far away from the people. Okay, thank you.
Thank you so much for Professor Porcia. So how about this one? Is it okay? Okay, as we come to the end of the, yes? Oh, one question more. Okay, Bapak Arya. Okay, before we close, one questions more from Ibu Agung. Please.
Okay, thank you so much. I was interested with your slide, Miss Professor Porcia, about the role model rather than the caretaker. It was very important for us. So as Professor Hadi also mentioned about that. And my question is, how can we encourage the student to be a role model in the future? Because I think it's difficult also for us in that situation like now in a global area. Okay, yeah, thank you so much.
I was given a task to explain transformational leadership. And I think right now, the generation right now is really not much more on the hierarchy. Because I think the gap between our age and the young generation is to feel, we should need to feel that they are belong to the group, belongingness. So part of the belongingness is a role model for us as a teacher. Example, a very simple for that would be time management. If we set our policy in the classroom that we need not to be late, because that is very important in terms of the nursing profession in the future, because we do have duties in the hospital. Let's say in the Philippines, we do have 6 to 2, 2 to 10, and if you are late, the nursing there are we need to respect the time of the others. So I think the simple way of role modeling for the students would be to transform them into a good having a good time management would be first the attendance. If you set as a teacher that you need to be here at 7, the teacher should be there at 6:45 as early than the student, so that the student will know that we are true to our words. It's like walk the talk. We need to walk our talk as a leader, as a teacher, and as a mentor and role model to our students. Like me, I'm very much in environmental health nursing. So in the Philippines, we do have what we call tree planting, because that's my mantra. I want to reduce pollution by taking care of them, doing planting of trees. We also collaborate environmental health to clean the ocean, because as I mentioned, there are many plastic, and we are part of that cleaning the ocean in the sea. So it's a role modeling for me, and of course to transfer that to the students. Okay, thank you so much.
Okay, thank you. Any additions? No? Okay, from Professor Hadi. Profesor Adi is okay. Okay, berarti semuanya sudah ya. Okay, as we come to the end of our session today, so allow me to briefly summarize some key messages from today's discussion. The first is about the transformative nursing leadership is essential for building a strong and sustainable culture of safety. Safety excellence must address patients, students, healthcare professionals, and the environment in an integrated and systematic way. And the last one is nursing leaders must confirm that clinical education environments are psychologically safe, well supervised, ethical grounded, and aligned with professional standards. On behalf of the organizing committee, I would like to extend our sincere gratitude to our esteemed panelists for sharing their knowledge and experiences, and to all participants for your active engagement both in the convention hall, in the Zoom meeting as well. We hope this seminar has inspired you to strengthen leadership practice for safety excellence in every nursing actions. Thank you for your participation. Stay safe, stay healthy, and then stay inspired and have a wonderful day. Terima kasih. Kapun ka. Suksema. I would now like to hand the time back to the Master of Ceremony. Thank you.
Okay, thank you, Miss Mary. Ladies and gentlemen, we have now arrived at the certificate and token of appreciation ceremony. This session is dedicated to our speakers and moderator for sharing their valuable knowledge, expertise, and experiences in this seminar. We kindly invite to all speaker and the moderator come to the stage. Please come to the stage to Professor Hadi, Prof. Porcia, and Miss Nita. And we also invite Honorable Rector and Chair of the committee come to the stage to present the certificate and token appreciation. The first certificate and souvenir is present to Professor Hadi. And the second certificate and souvenir is present to Professor Portia. And the third certificate and souvenir is present to Miss Nita. And the last for our moderator, certificate. And the last certificate for Associate Professor Kamala Turner. Achan, we will deliver your certificate by email, Achan. Okay, please stay. I can leave, want to please stay for Rector and committee and Professor Porcia. And for Professor Hadi, Miss Mita, you may return to your seat. Thank you. And the next agenda is second appreciation from Philippines, from Professor Porcia to ITEKAS Bali. Okay, thank you, Rector and Professor Porcia. You may return to your seat.
Oh, yeah, thank you so much.
You're welcome. Okay. Ladies and gentlemen, as we come to the end of the international seminar, on behalf of the organizing committee, I would like to express our deepest appreciation to the rector, all speakers, moderator, and committee members, and all participants for valuable contribution and active participation. We sincerely apologize for any shortcoming that may have occurred during this event. May the knowledge and insight gained today inspire us to become transformative nursing leaders who prioritize safety excellence for patients, students, and environment. With that, the international seminar is officially concluded. Thank you for your attention. Have a wonderful day and see you at the next agenda. Thank you.